Beaches crammed with people ignoring physical distancing orders, as well as fiery confrontations over refusals to wear a mask. There's no doubt the pandemic has created a new reality that some simply are not buying. But what is the psychology behind this behavior and that of those who willingly adhere to the rules? For more on this, we're joined by Dr. Stephen Taylor, clinical psychologist at UBC and the author of The Psychology of Pandemics, Preparing for the Next Global Outbreak of Infectious Disease. Doctor, thank you so much for joining us.
Thanks very much.
It's amazing because your book is quite prophetic in many ways. Lots to get to. A number of questions that I have. Let's begin with the issue of masks. Made mandatory throughout many municipalities in Ontario. Many more will be joining on. A lot of people, as you know, not exactly thrilled with this idea. Let's talk about the psychology behind that. Why some are just simply opposed in general to wearing a mask.
Well, there are all kinds of reasons why people are reluctant to wear masks, but in a very vocal minority, these people who strongly value their freedoms, a phenomenon called psychological reactance occurs. And that's a kind of massive pushback when government or authorities try to impose some restriction on persons' freedom. So these people strongly value their freedom. It's interesting, they very narrowly focus on their freedoms. They ignore the fact that masks might be helpful, but the focus is on protecting whatever freedoms that they have. So you get massive pushback.
Right. In many ways, though, it's kind of predictable because you have people who oppose to, their infringement on what they consider their freedoms. But isn't this in some ways just fueled by the mixed messages over the past few months from health officials, from even the world-leading health organizations who reversed their stance from even a few weeks ago?
Exactly. There are all kinds of reasons why people are reluctant to wear masks, and the mixed messages is part of it. Early on in the pandemic, we were told not to wear masks. We should save the masks for healthcare workers. And now there's been a quite reversal in position, and that can add confusion in people's minds. Interestingly, the same thing happened during the 1918 Spanish flu pandemic, where a vocal minority were highly resistant to wearing masks because they thought it infringed on their civil liberties and they didn't think masks were helpful.
Now, masks are one thing, but do you see the same connection with physical distancing? Is it a freedom issue, or is it just people, protesting just because?
It could be due to all kinds of reasons. For some people, they get a kick out of getting media attention for behaving badly. For other people, it's just wishful thinking. They want this to be over. And some people just underestimate the severity of the pandemic, because when you think about it, this is really a hidden pandemic. We're not seeing corpses or coffins stacked up in the streets. Hardly anyone knows anyone who's suffered from COVID-19. The people who are sick or dying are sequestered into hospitals. And again, this is very different from the 1918 pandemic where the sights of coffins was a daily occurrence. So the very hidden nature of the pandemic can lead people to underestimate their severity, and they might be the people who flock to the beaches, who flout social distancing.
From a psychological point of view, is it sort of just people getting, or at least trying to have some control over their life? Yeah,
people do all kinds of things to get control over their lives. They might go panic buying. Wearing a mask can give you a sense of control, or just trying to carry on as if this is all gone away. That can be a sort of wishful thinking that gives a person the illusion of control.
But an interesting byproduct of all this is the public shaming, because governments, health officials can put out all the warnings that they can, even making it mandatory. Yet a lot of people, as you mentioned, will defy the rules, no matter what the rules are. So from the psychology point of view, it's kind of up to people, or what it's almost a predictable result, isn't it? That people are almost, policing themselves, or how would you see that?
Well, in some ways, public shaming or your social network is a more powerful influence over your behavior than a top-down approach from government. And so if all your friends in in your social network are ignoring you or ostracizing you for not wearing a mask, that can be a powerful incentive to wear masks. And in fact, that happened during the 2003 SARS outbreak in some places like Hong Kong. You were avoided, ostracized, shamed if you did not wear a mask.
All right, Stephen Taylor, I appreciate your time and your insight on this issue. The author of The Psychology of Pandemics, preparing for the next global outbreak of infectious disease. Doctor, thank you again.
Thanks very much.